So here we go again. My name's Robin, and I'm the president of the Women's Democratic Club, and we have many of our board members here today. If you are a board member, would you give yourself a thumbs up so everybody will know? And Wendy Martin, you've got it exactly right. Everybody else can give those board members a clap. Let's clap for the board members. Clap, everybody clap. Board members deserve a clap. There you go. Yeah. Yeah, wonderful board members. We could not do what we are doing and what we are going to do without the most amazing board out there. So I just want to give them a high five. About 6 weeks ago, the Women's Democratic Club decided to make this pivot to Zoom, which was new for us. And we contracted for a channel that would host 100 people, thinking that was going to be a great plenty. Well, I am happy to announce that today, 99 people are joining us on this Zoom meeting, and each one of you has donated to come to this meeting. And because of you and because of your donations, we have gathered $2,300, give that a clap, that will go to candidates in the 2020 election cycle. So I am so thrilled about that. It's just wonderful. Thank you for coming. Thank you for donating. I want to thank everybody that donated $10, but I want to thank everybody that donated more than $10. And some of you were especially generous. So just know that your money will be well spent to get Democrats elected. I want to especially welcome several of you who are not yet members of the Women's Democratic Club. Thank you for coming. You are always welcome to come to any of our meetings, but I would be remiss if I did not encourage you to become a member of our organization. Well, we're doing some pretty fabulous stuff, and it's a great group to be part of. So WDC Utah, and you can just join right up, and we would love to have you as a member of our organization. We have some elected officials with us here today, so I just want to recognize, and she registered, I don't know if she's here yet, but she might be. Carol Spackman Moss, are you here? Can you say a word? Not here yet. Representative Moss and Councilwoman Ann Granado. And also we've got...
I believe Ann is here. Ann, let's give her a second to come off mute because she is using her phone. Ann, are you here?
I'm here. Hi, everybody.
Hi, Councilwoman Granado. Thanks for being here with us. And we also have Senator Reeby registered to be here. Do we have Senator Reeby yet? Oh, there she is.
Kathleen. Hi, everyone. How are you?
Thank you for joining us. Good to see you. 2 meetings in a row. Who knew? All right. Thank you for coming. So today, I'm going to kind of tell you how it's organized so you'll know what to expect. In a few minutes, I'm going to turn the mic over to Congressman Ben McAdams, and we'll have a little time with him, and we also have a little bit of time for Q&A. Then the mic will come back to me, and I'm going to pass that off to Denise Gascoigne. She is our program director, and Denise has put together this incredible program today, all of our incredible programs. You can clap for Denise. There's Denise. Clap for Denise. She does an amazing job with these programs. And Denise will introduce our speakers, and then our speakers will hand off the mic to each other, and then we'll come back together for some Q&A. And again, if you've got questions, just be sure that you put them in chat. And that way we'll find them, and we can be sure that we get all your questions answered. And if we don't get all the questions answered, we'll take our chat onto Facebook, and we'll make sure that if you had questions that we couldn't answer today, that we'll get those answers out on Facebook for everybody. We want everybody to get their questions answered. So with that, the young man I'm going to introduce does not need an introduction here. We all know and love Ben McAdams. And I just want to say to you, Mr. Congressman McAdams, that I hit my personal best in the number of doors knocked in your last campaign. So take it, Ben, take yourself off mute, and we're just thrilled to have you here today.
Well, thank you. Appreciative for the support last time. And look, we're going to have another difficult race this time. And so any help we can give, I don't know, who knows what it's going to look like, if it's knocking doors or phone calling or whatnot. Hey, I want to make sure we give a shout out to, I see a lot of candidates on today. And I don't know if you're going to do that later in the agenda, I won't do it
Yeah.
now. But are you doing it later in the
Yeah,
agenda?
well, they all get to speak
Okay.
at the end.
Okay, good. Good. Well, I see some great candidates. I am so excited about the people who will be on the ballot with me. People who I've known, many of them I've known for over a decade, and just know them in their respective professions to be leaders and standout individuals. And the state of Utah would be so lucky to have them win. And the Democratic Party is so happy, so lucky that they put their names on the ballot, because we have some great candidates. It's going to be a good year, I think, for Democrats. So I'm gonna watch my time here, but wanted to start with saying, first of all, I'm doing well. I'm going to tell you a little bit about my experience with the coronavirus. People always seem to ask, and so I've decided I usually in these Zoom calls will just say it right up front. But so I was in DC when everything started coming apart. That was, you remember the week that the NBA canceled their season, that the Utah schools started their remote learning. Women's Democratic Club shifted to Zoom meetings, and so it was that week that we were in Washington, and we were working on legislation relating to the coronavirus. And there was kind of a standoff between the Senate and the House and the president. And so we were supposed to vote through this legislation on Wednesday. It ended up being Thursday and then Friday, and it was ultimately Friday night, Saturday morning at 2 a.m. that we voted through this bill. We had worked through all the kinks and compromises and come to an agreement on it. We passed this bill. This is the bill right before the CARES Act. The CARES Act's the one that people kind of know the most of, and I'm going to talk about that a little bit later. But we passed that legislation about 2 a.m. I caught a flight at 6 a.m. to Utah. So I got about 2 hours of sleep that night, flew back to Utah. I got back to Utah Saturday morning, came home with, I hadn't seen my family in a week, so I was with my family. We stayed home most of that day. Saturday evening, I started feeling a little bit sick. And, I thought, I'm probably just run down. I haven't slept much this week. We've been working crazy hours. I got 2 hours of sleep last night. And so, I thought, everybody's saying we should be, at that point, the social isolation recommendation had come out. So I said, I'm going to stay home. We had actually plans. We had friends who were in town. We were going to go out with them. And I decided that, I told my wife to go without me, that just out of an abundance of caution. I didn't feel awful. I said, but out of an abundance of caution, in case I do have the virus, I just want to stay home. And so I did, and woke up Sunday morning and still felt just kind of off. It wasn't bad. I felt achy. I took my temperature. I had a temperature of about between 99 and 100, which doctors do not consider that as a fever. It's an elevated temperature and something to be, aware of, but nothing alarming. I called my doctor on Sunday morning, and he said that my symptoms did not justify a test at that point, but that I should continue to do exactly what I was doing, staying home, being careful to not expose anybody in case it was the coronavirus. But he said there are a dozen things that this could be. Your symptoms don't necessarily indicate that it's the coronavirus, so just be safe and stay home. So I did, and continued to monitor my symptoms. And by Monday night, as I went to bed Monday night, and I had a really bad night, my fever jumped to about between 102 and 103. I felt it kind of move into my lungs. I felt that I had like a belt. Someone put a belt around my chest and tightened it up. So I could breathe, but I just couldn't take deep breaths. It just felt kind of tight and just felt really achy. So on Tuesday morning, I called my doctor and said, look, I'm still sick. It feels a little bit worse. I described my symptoms, and he said, yeah, that probably justifies you getting a test right now. So he sent me to the clinic right here in Sugar House, the Sugar House Clinic. They had this drive-through clinic, and I went and got tested. And 36 hours later, my test came back and said that I tested positive for the coronavirus. So, the advice was, again, just stay home, don't expose anybody, get lots of rest, lots of fluids, everything that you do for any other type of flu, and watch it. And so it was then a couple days later, about a week into it, Friday night, I had probably pushed myself too hard during the week. I had been working some long hours, a lot of Zoom calls and conference meetings and staff meetings over the phone. And by Friday night, Friday evening, about 5 o'clock, I finished my work and just went and crashed in bed and was laying there. And at some point I got up and I walked across my bedroom, and I couldn't get more than halfway across the bedroom before I was out of breath. Felt like I just run a 5K. I was panting, had to lean on furniture to catch my breath. And, I went back and laid back down. I called my doctor, and he said, that sounds really alarming, that this coronavirus can go from where you are to deadly in the space of hours. We want you to go to the hospital and get checked out, and right now. So I immediately kind of packed up a few things in a backpack and went to the hospital. They first thing, they admitted me and tested my oxygen. My oxygen levels turned out to be pretty low. Usually your oxygen ideally is at 100. Anything in the 95 to 100 is normal. Anything in the low 90s is concerning, but you're not going to be hospitalized for that. Mine was in the low 80s when I checked into the hospital, and so they put me on supplemental oxygen with the hose right there at the bottom of your nose, and put me in, and they were able to bring my oxygen levels up when I was getting that directly in through my nostrils. And but anytime they take the hose away, the oxygen away, my levels would just tank again. And so I spent 8 days in the hospital feeling as sick as I've ever felt, and couldn't shave actually for 8 days, had no energy to shave. So my energy's come back, but my desire to shave hasn't. And I spent 8 days in the hospital just feeling really sick. And so I was symptomatic for 16 days with kind of the whole flow of that virus. And then I came home, and when I was discharged from the hospital, I came home, I had lost 13 pounds in the 8 days that I was in the hospital. So even though the virus, my body had developed the antibodies and we had fought back the virus, I still felt just wiped out for another 10 days or so. So I was at home, but happy to say now I've been home from the hospital for just over 3 weeks, and I'm feeling really good, and back working and doing everything I can to represent Utah throughout this process, both in Washington and here at home. So let me just tell you a little bit about what we've done in Congress during this time to help with this pandemic, this crisis that we're in. The first few pieces of legislation we passed were focused on slowing the spread of the virus and helping those who were in critical shape because of this virus. So what you want to do in a pandemic is you don't want anybody to have a fear or financial obstacle to getting tested. So we passed legislation to ensure that testing can be free and provide funding for that testing, that it's free for anyone who wants it. You want anyone with symptoms to be able to go and get a test because you want to be able to know where the virus is and to slow down the spread of it. The other thing we passed was a requirement, a provision that provided for sick leave for anybody who was sick with the coronavirus. You want people who are struggling already, and look, this is maybe a topic for later or even another day, but this virus sadly has really exposed something that we already know as Democrats, and that is how unjust our society is and how at risk we place our minority and vulnerable communities, and economic disparities, how they treat this country's people are situated differently, and this virus has exposed that. So when I was sick, had the luxury of saying, so it was still kind of early that it wasn't clear that we were all going to stay home and not go to work, but I said, look, I don't feel well and it could be the coronavirus. I'm going to work from home. And fortunately, I have a job and that is secure and where I can stay home. So many people don't have that choice. And when feeling like I was in the early days, just a little bit off, a little bit achy, a little bit of a high temperature, and knowing that they're living paycheck to paycheck and they got to buy groceries and pay the rent, they're going to probably choose to go to work, and that's going to further spread the virus. So we needed to make sure that people, at the very, very least, had the ability to stay home and continue to get sick leave and a paycheck while they were staying home. so they could support their family. There's so much more we have to do in the longer term, but in the short term, that's what we needed, was some paid sick leave. And then comes the CARES Act, as we see really how hard this virus is hitting our country, and we were slow to respond to it, so it's really spread rapidly throughout the country. So we knew that we were going to have to be pretty draconian in our shutdowns and asking people to stay home and businesses to close, and that was going to have a serious economic impact on so many Americans and on the economy. And I make the analogy that essentially what we did is we put our economy on a medically induced coma, and it needs a ventilator. And so the ventilator became the CARES Act, where we gave the economic stability payments to every family of $1,200 plus $500 for a dependent. We increased the funding for unemployment insurance, knowing that millions of people were going to have to file on insurance claims. And we passed the payroll protection program to try and get money to our small businesses to help them. These businesses that have nowhere else to turn, they needed a lifeline to get through. So we kind of sometimes with shorthand call that the economic stimulus. I think that's probably too generous of a term, because there's really at this point no economy. The economy's on a medically induced coma. There's nothing to stimulate. So what we've done with the CARES Act is put the economy, it's just relief. It is essentially a ventilator to keep the economy and the American people, financially speaking, breathing, since they can't do it for themselves right now because of the spread of this virus. And so that's the legislation we passed. The kind of the rationale behind it is first and foremost to make sure that people have the essentials of what they need, that they can meet bare bones food and shelter and expenditures. And sadly, we're seeing a lot of people who are falling through the cracks. As much as we've tried to create this safety net, a lot of people are still falling through the cracks. And but we also have seen some gaps in this legislation. I think Congress was at a point where we had to choose between doing something fast and doing something perfect, and we couldn't do it both. So we did something fast. We could have spent 2 years debating through committee work, refining this legislation, and then passed it, but it would have been too late. The patient wouldn't need the ventilator at that point. So we had to do something fast. Now we're seeing a lot of cracks in that, and so I'm working hard to try and fill those cracks and make sure that safety net can catch the people who are falling through it. As it has helped millions. There's still people falling through the cracks, and so that's where my focus is now, is helping those people who have fallen through the cracks. One of which, and let me just conclude because I think I've taken my share of time, is something we've seen with the payroll protection program, the small businesses who have stepped up to get their loans. And the rationale with this is to maintain not only meet the immediate needs of the American people, but to maintain some of the connective tissue of our economy. We want to be able to turn the dial and turn up the economy as the virus abates. And when it abates, we can turn up the economy. But to do that, what we need is not a business that's in bankruptcy proceedings. They've moved out of their office space or their retail space. And then to ramp up the economy, they're going to have to look for office space, look for funding with bad credit, look to hire employees. The economy would be broken at that point. We want to maintain the connective tissue of our economy so that employees are connected to jobs, businesses are connected to their office spaces and leases. And so that's what this payroll protection program does, is it provides direct funding to small businesses that is forgivable if they follow certain guidelines. It's essentially free money if they follow the guidelines that we set out. Legislation set it out broadly with the expectation that the SBA and the Treasury would dial in and do more specifics as they set up this program. Sadly, one of the things we've seen with this program, while I think it's been largely a success and helped many, many businesses and put paychecks in the pockets of millions of Americans, one of the things we've seen is, again, the inequities of privilege in our society. So many of the businesses that were able to, the money, even though it's been billions of dollars, at this point, $700 billion for this payroll protection program, that is finite. It ran out the first time. We came back with a fourth piece of legislation to put more money into the payroll protection program, and it's going to run out again. And the problem is I'm slow to place blame on this because I don't know that I've seen right now bad actors or nefarious actions. We may see that with time, but right now, giving our institutions and our government leaders the benefit of the doubt, what I think is apparent has happened at the very least is the people who are able to jump in line and to be at the front of the line are those businesses who have accountants and lawyers and people like that on staff. They could turn around an application. They bank with the big mega banks, your Chase Manhattan Bank, these large banks that are also more sophisticated. And so the people at the front of the line where you're more sophisticated, this is your Ruth's Chris. They also were able to exploit some loopholes, Ruth's Chris and Shake Shack and others. And they were at the front of the line and they got this money and it ran out. And who was at the back of the line are your minority owned businesses, your small businesses, your mom and pop businesses. These businesses were all at the back of the line. And when they had applications in, the money ran out and they were left with no resources. So we've come up with this, putting new money in. We've tried to set aside, we did set aside of the 700 billion, 60 billion to go to small banks and credit unions, minority owned banks and credit unions, under the premise that their clients are probably these small businesses who we're trying to get the money to most. But you know, I'm still concerned at the way that it's played out. So this week I called for the SBA to release the names of businesses who have received funding under the payroll protection program. And you know, it's not to shame anybody per se, but it is to know who the Shake Shacks are, who may have exploited loopholes in the legislation or the directive from the SBA to get funding that they don't need. Now, look, Shake Shack probably needs it. Ruth's Chris probably needs it. They've also been hurt by the economic downturn. But Shake Shack and Ruth's Chris also have other places they can turn for their funding. And so we are hoping that the money can go to those businesses who have no other place to turn and no other recourse, and they can continue to stay vibrant and viable so that when we're ready to turn on the economy, they are there and their employees are ready to, again, resume doing exactly what they're doing. So I want to just conclude there. And it's great to be back with the Women's Democratic Club. It's been a little while, a couple of years, I think, since I've been to a lunch. I look forward to an in-person gathering when we're ready to do that. Thank you. Opening the chat. I see some chat messages.
Thank you, Ben. That was great. It was wonderful to hear from you. And if the stars align, Ben, we are on your schedule for the evening of September 15th, an evening meeting with Ben McAdams. We got on your schedule early on, so maybe that will happen. Who knows? I hope.
Let's hope so.
Let's hope so. We do have some questions, Ben. Let me ask you a couple of these. With everything going on with COVID-19, is the House meeting and voting virtually for the remaining days of the session?
We are working on a virtual voting proposal, and honestly, there have been different proposals that just haven't been able to get a consensus. We're talking about bringing us back on Monday, but Washington D.C. is a bit of a hotspot right now. They spiked, and so people concluded, physicians and others concluded that it's probably a bad idea to fly in 500 people from literally every part of this country and then put them in that stew and then fly them back home. Didn't make the best sense. And so I think, look, Congress needs to walk the walk as far as following the guidelines from the CDC, but also some of our work as a member of Congress is essential and does require me to leave my home to do my job. And so look, I'm it's easy for me to say because I probably have some immunity after having had the virus. I'm ready to jump on the next flight back to Washington, D.C. to get back there to do the work. But remote voting, I think, needs to be part of it, that just even for the sake of continuity of government. I'm not a fan of remote voting generally. There's just something to be said about interfacing with your colleagues, having those conversations that it's the same as any workplace. You know, you can get by with Zoom, but there's nothing like collaborating in person, and the ideas, the innovations, the consensus building that comes out of that in-person collaboration. I'm not a fan of remote voting generally. I do think in times of emergency, in this pandemic, for the sake of continuity of government, we do have to have some tools available. Some of the concerns are, how do we make sure that it's not hackable with, so many foreign powers trying to hack everything in this country, something that's safe and not hackable, something that, still allows for debate and discussion. Something that one of the concerns about not having in-person meetings is you cede a lot of authority to leadership. And I will say, even right now, a lot of what's getting proposed that we will be voting on is happening a discussion between Democratic leadership, the White House, and Republican leadership in the Congress. And that's what has to happen in times of a pandemic. I'm not comfortable with it more broadly, because I do think that I want to make sure that I'm there and raising my voice in the conversation, that all of us are able to, from across the country, do our duties as members of Congress to congregate to Congress and have those debates and discussions. I think that's important. So, long way of saying, yes, there's some proposals being worked on. I would expect us to, it was going to require a rules change. So I'd expect us to vote on that rule change in the next couple of weeks. And we have to be there in person to make that vote. And then we'll have a tool for remote voting, but it's probably going to be limited in times of national emergency.
Interesting. All right, Ben, we've got time for one more question. And although this is kind of more of a CD4 question, but we've had enormous tragedy in our Navajo Nation. Just wondering if you know anything about how we can get funds and how we can get help to our Native, I'm sure it's not just Utah, to our Native American tribes that are so vulnerable.
Yeah, so I've participated in several Zoom meetings with the leadership of the Navajo Nation and with their concerns. Congress, to be clear, has appropriated the funding that they've requested. It has been a bureaucratic morass that has prevented them from receiving that funding. And now they are getting hit really hard. This is, per capita, they are one of the highest places in the country in the way it's impacting the Navajo population and looking to continue to spread. And so it is really alarming what's happening there. And, we are working hard to get them the resources that they need, but it's been a failure. Again, I think a failure of the federal government to adequately and in a timely way appropriate to get them the funding that had been appropriated over a month, almost 6 weeks ago.
Right. Well, I think that's about all the time we have today. It's just such a joy to see you and know that you're healthy.
Thank you.
You're out there representing us.
Thank you. It's a pleasure to represent you, and to all the other candidates out there. I look forward to working side by side with you on the campaign trail. Thank you. All
right, now everybody give Ben a clap. Get to that clap button and give that man a clap. Yay, Ben, yay. All right. Terrific, Ben, thank you. Come back and visit us often.
Thank you.
All right.
I'm going to read the chat here, and then I'm going to have to run off. So I'll just skim the chat.
Okay.
Thank you, everyone.
Cruise through the chat. I'm going to turn the mic over to Denise Gascoigne, our program director, and she's going to introduce our speakers today on a very important topic that became even more timely within the last 24 hours. So, Denise.
Well, thank you, Robin, and thank you everyone who's attending, and thank you, Representative McAdams, and for all the great work you're doing in spite of the challenges, and I'm glad that you were able to overcome coronavirus. So today's topic is a very heavy topic, and it might be triggering, some of the discussion might be triggering for some of you, particularly if you've had adverse experiences. We have three great speakers today. One of our speakers, Maria Drummond, who's a recreational therapist with the Salt Lake County Youth Services, was unable to make it. She's fallen ill, so we wish her the very best. She was going to be discussing a landmark study that came out in the mid-90s, which has really given us a lot of insights into the longitudinal aspects of adverse childhood experiences. It's actually called the ACE study, and that ACE is the acronym for adverse childhood experiences. She was also going to be discussing the importance of play and recreation for helping children to navigate adverse childhood experiences and overcome them, and also for adults. So we'll have our social media experts at the Women's Democratic Club post some information related to those topics on our social media pages, so you can reference those at your leisure. Our three speakers today are really remarkable individuals, champions within our community who are on the front lines of these crises. And our first speaker, Jen Oxborough, is the Executive Director of the Utah Domestic Violence Coalition. Our second speaker, Laurie-Ann Thorpe, is the Executive Director of the Prevent Child Abuse of Utah, as well as serving in a leadership capacity of the Utah Board of Education. Our third speaker is Barbara McCleary. She's a certified law practitioner, retired from the State Attorney General's office. She was in the trenches of juvenile court and advocating for child abuse, neglect, and dependency victims. Just to give you a little bit more background on each of the speakers, Jen Oxborough is a licensed clinical social worker. She is a graduate from the University of Utah, as well as Pennsylvania State University, from the College of Social Work there. She has really been working hard within the Utah Domestic Violence Coalition to be an authority, and the organization is actually a private nonprofit organization federally recognized as the statewide authority for best practices to support individuals impacted by domestic violence. And as we all know, this crisis of COVID pandemic has put additional stresses on families, and we're seeing the effects of that within an uptick of domestic violence and cases, and one of which came to the fore last night. So Jen will be able to really go in depth into that. If you have questions for any of the speakers, please put them within the chat option to everyone, and I will pose those questions to the speakers at the end. Laurie-Ann Thorpe, as I mentioned, is the Executive Director of the Prevent Child Abuse of Utah. She's been really instrumental in advocating for children and families, as with the Domestic Violence Coalition. The Prevent Child Abuse Authority of Utah has been really the go-to organization for the state to address and understand and prevent child abuse within our communities. Laurie-Ann has a master's degree in public administration from the University of Utah, and has been both Laurie-Ann and Jen have children and families, and so Laurie-Ann also is a foster parent, so she can be a resource for that if you're interested in learning more about that as a way to serve our public. Barbara McCleary originally grew up in Hartford, Connecticut. She's a graduate of the Wharton School of Business at the University of Pennsylvania. So I don't know how Pennsylvania State University and University of Pennsylvania, if there's a rivalry there, but Barbara and Jen, you can perhaps mention that or speak to that if they, but Barbara moved to Utah she met her husband here on a ski trip. And she's, as I mentioned, has recently retired from the State Attorney General's office, and she'll be really able to kind of bring it all together, at least within the aspect of the law and our legislation. So without further ado, I would like to pass it off to Jen Oxborough.
Hello, everyone. Can you hear me?
Mm-hmm.
Thank you so much for inviting us to be a part of this conversation today. It's a real honor to be here with you and to hear updates. from everyone. So thank you for making time and space for me. I look forward to talking with you and hearing your feedback, both here and hopefully beyond this conversation today too. So as was mentioned, the Utah Domestic Violence Coalition has been around since the late 70s. We were federally recognized under the Violence Against Women Act that was created federally in 1994. And that was co-authored by then Senator Joe Biden, and had strong support initially from our Senator Orrin Hatch, who ultimately voted against it in 2013. But Senator Biden, Vice President Biden, really ushered that in and created coalitions like us all around the country. Our work is focused on representing a team of community-based programs across the state. In Utah, that's 14 private nonprofit organizations like the YWCA, South Valley Services, CAPSA, the Dove Center. We have 14 that serve 29 counties, so you can imagine we're quite busy. Back in the old days, we used to call those programs shelters, but they do a lot more than shelter. They provide 100,000 nights annually of emergency shelter, and they also provide comprehensive victim services. They provide case management, crisis counseling, childcare, mental health services. They provide a range of housing services, helping people to develop economic stability and housing safety and supports. And they also provide sexual assault services. So all of our programs are serving survivors of domestic and sexual violence across the state. Some of our programs are serving as much as 15,000 square miles and 5 counties. Others are located in urban areas and have different challenges there. The coronavirus COVID outbreak has really stretched us and our services even more thinly. On an average year, we take about 43,000 crisis calls collectively with our statewide hotline that UDVC runs and our member programs. Our call volume is up anywhere from 30 to 40% week to week. And the request for our services, depending on the type of service, the request for services has skyrocketed as much as 50 or 60%. So you can imagine with a challenging service delivery system already and limited funding, this demand and some of the nuances of the COVID crisis have really pushed us even farther. But we are open, we are not turning anyone away. We have developed protocols with our programs, including funding mechanisms to make sure that they're meeting the demand and the need. And so services are available, and that's something I just can't say loudly enough. Please help people understand that. We've been doing a lot of work in the media to try to help people know that we're here and we care, and we're still providing care across the state. If it's unsafe for someone in a particular area, or if they're trying to reach out to services and need help to get there, we can make that happen too. We have some emergency funding resources to help people with travel expenses, and to provide some economic stability to make sure that they have safe resources for being in their home. But you can imagine with the isolation and the requirement to shelter in, that isolation exacerbates the domestic violence risk for people and the risk of sexual assault at times too. So it can be difficult to call and talk to a professional advocate or call police. It can be difficult to reach out in a normal setting, but during this crisis, we're hearing from people that it's even more challenging for them to find the space and ability to connect with our programs and services and professionally trained advocates. So one of the things that UDVC does in 2015, we went to the legislature with some data from the Utah Department of Health, and we're very concerned about the percentage of our homicides in Utah that are related to domestic violence. When we look at that and do a deeper dive, we see that the domestic violence fatalities, including suicides, officer-involved shootings, children, innocent bystanders, who are involved as an act of domestic violence that turns lethal, that rate and trend was very high and escalating. So we partnered with the Utah legislature and we adopted an evidence-based approach called the Lethality Assessment Protocol. We refer to that lovingly as the LAP, L-A-P, You can find more information about that at our website at udvc.org. We now have partnerships with over 80 law enforcement agencies across the state, and we literally are on the same page. We're using the same screening and referral mechanism for high risk, determining who's most likely to be killed by a current or former intimate partner. And we're referring and triaging and coordinating our services to those highest risk individuals now across the state with the support of the legislature. 2015 was the first time that the state legislature made an investment of state general funds ongoing to expand those partnerships and direct services for survivors. And the reason we adopted that protocol was because it had been evidenced to work in other places, dropping the domestic violence fatality rate when that protocol is implemented to fidelity over 3 to 5 years. So that happened in Utah. We saw our domestic violence fatality rate drop in 2017 and again in 2018. And even though we've had several terrible tragedies, including just yesterday, we are still pacing at a slower domestic violence homicide rate for 2020 than we did in 2019. So if you're interested in looking more in depth into the nature of those fatalities and trying to understand that, you can find information on our data page at udvc.org as well, or just reach out to me. I'd love to talk with you too. The most important thing to recognize is that domestic violence is a preventable public health issue in Utah, and we're seeing that when we partner and use evidence-based approaches that are safe, and we have the resources to do this work, that we can make a difference. We can improve the rates and trends, and that's especially important in a time of crisis like this. So I just want everyone to know that we're here, we're not going anywhere, we're strengthening our approach, we're trying to be smart about how we use our resources, and we welcome partnership and feedback from our community. That's why we're here. I can wrap up there. I want to be sensitive to time, but I'm also happy to answer questions if there's anything that anyone would like to talk about.
Jen, I think we're going to hold off on questions till the end.
Okay.
So if we'll go ahead and pass it to Lorianne.
Great. Thank you.
Hi, everyone. So it's such an honor and a pleasure to be here with you today. I'm Lorianne Thorpe, and I'm the Executive Director of Prevent Child Abuse Utah, as was mentioned in the introduction. So I wanted to talk shift a little bit to child abuse in Utah, and specifically what's happening right now and what you can do and what we're doing so that we're all sort of helping in this really crazy time. So Jen mentioned that rates of domestic violence are way up and during this time and I think it's understood why that is the case, because folks are sort of in lockdown and they are sort of stuck. And what we're seeing conversely with rates of child abuse is probably not indicative of what's actually happening. What we've seen with rates of reporting child abuse is that those numbers have plummeted by half. So we have half as many reports of child abuse right now than we did last year. And I think that is not because we have less child abuse. I think that's because that is an indicator that children do not have a voice to report when things are going wrong for them. And that is incredibly concerning to me at this time. I'm sure it's concerning for you. It's concerning for you who have family members you love and kids that you care about and are in your home and are in the homes across the street and down the street from you and in your extended family. So something I want to talk about, especially because what we see is that when family stressors go up, so do incidents of child abuse. And I can't really think of a more perfect or dangerous storm for kids than the stressors that are impacting families right now. Something I want you to think about is, for children, the safety net that protects them is really gone during this time. Folks who put eyes on children in a protective way, those eyes are just not there right now, and that is something that's very concerning. And just to give you an idea of what the general trends are, any time that there is a school break and then kids come back to school, the number of child abuse incidences and reports go way up. So that's after Christmas break, that's after summer break, that's after spring break, all the time when kids go back to school, that's when we see an increase in reporting, because that is where there's a social safety net for kids. So I anticipate that we are going to see the same thing once the safety net comes back for kids. But right now, it's a really silent epidemic, which I think makes it doubly dangerous. Something I want to have you help me think about is, we talk all the time about protective factors for families. There are 5 protective factors that families need to be strong and resist having child abuse impact their homes. And 3 of them, I think, that have been impacted by COVID-19 are, first of all, social connections. That's a big deal for a family to be healthy. They need to have social connection. And that's not really happening. When it does happen, it's artificial like this, which there's still value to those artificial interactions, but it isn't the same. And we know that. And we know that that has an impact in stressors for families. Then there's also, and of course that impacts kids as well, parental resilience is another protective factor that I think is impacted right now that we need to pay attention to. Our reserves have kind of come down as just families and adults who we're all used to routines. We're creatures of habit, and we rely on things. And I don't know about you, but I've coined a term since I've been home of, and now I've forgotten it, of course, but it's simultaneity. That's the word, right? Where you're all the things to all the people that care about you at the exact same time. And there's no really separation between work and school for kids and caring for your parents who may be at high risk, or other family members who may be at high risk. There's a lot piled on to families all at once right now. And I think our resilience reserves are a little low. And then the other thing is concrete support in times of need. So as we see families losing jobs, and we see food scarcity concerns, these are things that are concrete needs in times of support and in times of need that families just don't maybe have access to right now. And what we find is, and I'm sure that this is the case with Jen, those who would normally reach out for the resources are the ones that are the ones that need it the most, or the hardest to reach. So that can be difficult. So those are 3 protective factors that I think are impacted right now. So what can we do about it? One of the things that we need to make sure of is, just as responsible adults in the community, that we are inserting ourselves into the lives of our friends and loved ones. We're making sure that we're seeing kids outside playing next door. We are listening in a new way. We're texting, we're making phone calls, we're asking probing questions. For example, when we are able to talk to kids, whether it's on the phone or through an interface like this, we're saying, how are your pets? Show me, right? Because pet abuse can be an indicator that something is going on too. So that's an interesting correlation. So look for that. And then our families, I mean, there are things that teachers can do to keep an eye out to. Have kids disappeared off of outlets that they would normally see them on? Are they picking up school lunches when they used to get free school lunches? Those can all be indicators. So, and then anytime there's any suspicion, the number one thing I want to emphasize is report. And I'll put in the chat the child abuse hotline number, but just because you can't say it too much, it's 1-855-323-3237 for the child abuse hotline. It is never a bad idea to report when you have a suspicion of child abuse, and plus it's required by law, so you might as well. So Prevent Child Abuse Utah is doing our level best to give kids a voice and help them understand when abuse is happening, because that's an obstacle that we have to overcome. They don't always know that something is wrong when it's happening to them. And we are also supporting families and mentoring parents into becoming better parents and building protective factors for families. So those are some things that we're doing. If you'd like to learn more about us, you can check out our website at pcautah.org. spelled out.org. And we have free courses that are available there. Please follow us on social media. Our staff has been incredible at putting out family packets of resources online, and it's really been incredible. So if there's anything that you can do, I would say number one, take care of the people that you care about. And if you have any questions for me, or if I can be of support, please let me know. So I'll turn the time next to Barbara McCleary.
Thank you. And I do agree, even though I retired from handling child abuse cases in January, I have spoken to staff in my office, other attorneys, and yes, the numbers are way down right now, even though you think they'd be way up. I think there's just that whole feeling that so much is going on that we're not going to get involved in
Have we lost Barbara?
Yeah,
She might have been frozen for a little bit. We'll just give her a few seconds here and see if she can't restore her connection.
Well, we could while we're giving her a minute, it's a great time to jump in the chat. Be thinking of the two speakers you already heard from. What are some action items you could take? We've heard about these two organizations and these two different just really horrible situations in Utah. If there's something you know and you were reminded of something you could do, or a payment you were wanting to make, or someone to reach out to, put some of those thoughts in the chat. It's a great way to just remember what we've already been told today. And we'll wait for Barbara to rejoin us.
And while we're waiting for Barbara, I was going to make this announcement at the end of our meeting, but I'll go ahead and make it now. All of us know, I mean, these are heavy topics, and all of us know that every nonprofit right now is scrambling for money. And we also know that the YWCA is, for many women and families, their absolute lifeline. The Y is Utah's most comprehensive provider of family violence services. They run a crisis line. They've got walk-in services, an emergency shelter, transitional housing. They've got programs for children. I mean, they really are a backbone of trying to take care of so many of the issues we've talked about today. So this is a fun thing. The Women's Democratic Club is partnering with the YWCA, and we're creating a campaign that is known as Donate Your Gift Cards. I'm thinking that most of you, if you looked around, there are going to be a few of you that have got some gift cards out there that you are not using. And gift cards are one of the ways that the YWCA uses to help empower women. They get these gift cards, and they get to go to Target, and they get to buy what they want to buy, what they think they need. They get a gift card to Sizzler, and they get to go and have a meal that they choose. So if you have gift cards that are just sitting there with an unused balance on them, we're going to be blasting out the Women's Democratic Club post office box, and we will send them to us, we will gather them, and then we will gift them to the YWCA. And when I talked to the YWCA yesterday, I cannot tell you how excited they were about the idea that they could get these little tickets of freedom for so many of the women and children that they work with. So please, look in that drawer. You've got a gift card you haven't used. I know it. So do you think we're going to get Barbara back?
I'm expecting her to rejoin, but if you have her direct contact information.
I just texted her and told her that she cut out and asked her to rejoin. But while we have a few minutes, and for those of you who maybe didn't hear, I had asked that you submit your questions through the chat. And so we've had a few questions already. And and I don't know if you've been monitoring the chat, all of you, but there have been some resources placed in there by Jen and Larianne. One of the questions for Jen is that with the Violence Against Women Act funding having been defunded in Congress, are you aware that it's going to be refunded? And then how are you getting your, making the shortfalls in funds?
That's a really great question. Thank you. And thank you so much for supporting the YWCA today too. They're one of our really powerful, important programs here in Salt Lake City. And they also partner with our sisterhood, our team of programs across the state. So we do a lot of referral and movement sometimes of survivors and families between programs to improve their safety. And the Y is a really critical element of that work. We have other programs. I just shared a link if people are interested or have family members or connections to other communities across Utah, including some of our tribal communities. I just put up a link in the chat where you can find all of our member programs and all of the different work that they're doing. If anyone ever needs help, you can call our link line, which is that 1-800-LINK number. And we'll connect you back with resources too. The Violence Against Women Act provides core funding for all of that work in every single state and territory across the country. It is our keep the lights on and the doors open money. So the Violence Against Women Act really formalized our response to domestic violence, and it has to be reauthorized at various intervals. When it was up for reauthorization in 2013, Senator Hatch voted against it because it became more expansive. It was requiring us to, if we took the Violence Against Women Act funding, that core funding to keep the lights on and the doors open, we were required to guarantee that we would serve men, the LGBTQ community, and so all of our programs are doing that. They all serve men, they all serve anyone with a substance use disorder. We're serving people who are ill or might be at various levels of danger or have different sorts of challenges. As the Violence Against Women Act has evolved since 1994 when it was first created by then Senator Joe Biden, we have seen a response that's fairly negative from the Republican side often, where it's viewed as a Christmas tree bill. It includes too many things now. And so it has stalled in the Senate last year for reauthorization because we had several Republican leaders, one from Iowa in particular, who was trying to dismantle it and revise it. After it passed the House, in the Senate, they were offering different strategies to limit the funding and limit the scope of what the Violence Against Women Act does. One hot item, one very contentious aspect of that is the boyfriend loophole. So the majority of domestic violence homicides are perpetrated by a man against a woman, and most frequently with a firearm that he shouldn't be able to have. He should be a restricted person because he's had a previous history of domestic violence, most commonly. And so the Violence Against Women Act was seeking to formalize that and make very specific terms about domestic violence firearms restrictions. And that's why the NRA came out very strongly against it, and several Republican leaders, including our own Representative Curtis, Congressman Curtis here, offered in the House unsuccessfully a revision to the VAWA reauthorization that Congressman McAdams strongly supported and ultimately helped to pass the House. But we keep stalling in the Senate. I think I've met with Senator Romney. He's supportive of it, but it's difficult. It's a difficult thing to get behind when there's such strong lobbying support against it. And so hopefully we'll see the full authorization and appropriation of that act in the coming months when Congress figures out how to reconvene. We're working on that with our national network to end domestic violence, and we put out policy briefings and updates on that regularly. So feel free to reach out if you have more specific questions.
Thank you so much. Larianne, one of the questions is, well, actually, I have this question. Based upon your experience and your integration with the Utah Board of Education, is there a way in which children through the remote learning are being aware that there are resources maybe that they can call if they are being victimized?
So part of the work that we do is we go into schools and talk to kids and teach them to recognize, resist, and report abuse. So we're part of that safety net when school is in session. So we've done a lot of work prior to this happening to help kids understand that when it's happening to them, it isn't okay. But since things have closed down, we've also worked with schools to provide resources. We've pushed resources out to school counselors and through the State Board of Education, some tips for things that teachers and school counselors specifically can do right now to look for yellow signs of abuse so that they can stay on top of and monitor the kids that are in their classroom, even if they're not face to face. So that is something that we are working really hard on.
Okay, I don't really see too many, thank you for that. I don't see any other questions. Do we want to open it up to the attendees, Robin, to maybe ask a question?
Barbara's back.
Oh, she is, okay,
Yeah.
great, never mind.
So I'm gonna spotlight her video and she can continue. Sound good? Here she comes.
I am very sorry. I lost internet connection. I do live in Midway, Utah, and have not the best. I have one choice for internet service, and it's not real high speed. And when the weather gets troublesome, I sometimes have internet problems, but I can't believe that happened. Anyway, I think you lost me right away, but I handled cases of child abuse and neglect for just about 25 years, and I worked in juvenile court. I did not handle the criminal prosecutions, and that is done by the county attorneys in the various counties. My client were the social workers, the Division of Child and Family Services, which is really the state agency responsible to conduct child abuse investigations. If the case was serious in nature or sexual in nature, then law enforcement would be joined in to assist in that investigation. Otherwise, just about all the investigations are done by the child protective investigators working with the Division of Child and Family Services. So, as was being said, unless a report is made about child abuse, an investigation is not conducted. So unfortunately, there's a lot of child abuse going on that we don't know about. We don't know what's going on in the home, and unless someone talks about it. I know there was mention with coronavirus, how the numbers are down, and I had checked with my office. I was curious myself, thinking the numbers should be going up, but no, they're going down. I think that's just because there's such concern about health and safety that everything else has kind of been put on the back burner. Although I think it was just this past week, I heard in the news about a father being arrested for child abuse of his 4 young children, and they were ages 6 and under. And this investigation, it was typical of many that I handled. It only came about because the youngest child, an 11-month-old, was brought to the hospital for treatment of a broken bone. That child fortunately was examined by the Safe and Healthy Families team, which is a specialized team of doctors at Primary Children's Hospital that has special training to determine whether the child's injuries are consistent with abuse or that they're accidental. And the doctors had determined that this baby's broken leg resulted from child abuse. Further investigation was done. The other children, the ones that were able to talk, were able to disclose abuse by the father, and those actions were taken to protect those children. But those children, it wasn't surprising to me, they lived in their home, a basement apartment of their grandparents, which you would think would be a protective factor, but yet this abuse was going on. And this abuse would still be going on had not one of the children needed medical attention. And that's one of the travesties about child abuse, that very often nothing is, or things aren't done to help those children until a tragic happens to the family. A child's injured, and unfortunately, very often it is serious injuries. And so it is key that reports be made to the division. There are certain professionals that are mandatory reporters, such as teachers, law enforcement, mental health professionals, clergy, but most reports probably come from, anonymous neighbors, bystander, and unfortunately, children very often do not report abuse. They're afraid, or they've been threatened not to make any disclosures because they've been instructed, do not reveal family secrets. They might be more willing to disclose abuse if it's by an unrelated individual not in the household. But most of my cases I can't say were made from, came from the child making reports of abuse. There also in this state is this whole distrust about state involvement in families' lives. People don't want the state to tell them how to parent, and the state shouldn't be telling them what to do, and children should not trust social workers and not talk to them. So that's also a deterrent to addressing this child abuse problem, this whole distrust of the system. I will say, in working with social workers for all those years, that they do excellent work. I put them on the same par as medical personnel and the first responders, as we're thinking of as heroes today. The social workers are those unrecognized individuals trying to help families, trying to keep children safe, trying to facilitate appropriate resources to prevent the child abuse, neglect, or prevent removal of the children from the home. Because usually the removals only happen if there's been serious harm to the children, or a serious threat of harm to the children, such as that family this past week in Salt Lake with the 4 children. But the other big problem, I guess, is, or concern is, all this information is private, confidential. The public doesn't hear about the abuse going on. You only hear about it when there's a companion criminal investigation and an adult is arrested on charges related to some type of child abuse. So the public doesn't know about the Division of Child and Family Services doing good things or helping families, but rather there's that ongoing distrust. Another point that I want to make is that a lot of these families also, it's usually not just one problem, it's a number of problems. So yes, someone's called in to report domestic violence and children were in the home. So the division would conduct an investigation about that. And unless they have been able to identify that maybe that parent has a drinking problem or a drug problem, help isn't given to that family. So it is key for all the problems to be identified. As you know, when I know we had already talked about domestic violence, and as far as whether it's related to child abuse, sometimes the victim are the children, sometimes the victim is the parents, but in both situations, the children are really adversely impacted. The cases involving serious child abuse or sexual abuse were always difficult cases for me because it's common sense. We shouldn't be hurting kids. Children shouldn't have their limbs broken or be burned or be beat up or sexually exploited. It's a really hard problem. And unfortunately, it's one that's ongoing and is not going away. And the numbers are increasing. And they're not decreasing. So even though the reports are not being made yet, I know in my years, my caseload seriously would always grow. There's more judges being added, more attorneys being hired to handle this problem. So it is a difficult problem. And the other thing I just want to bring out is a lot of times when I looked at a case, I thought of it as the tip of the iceberg. So yes, we knew about what information was reported, but we really didn't know what was going on in the home. Children don't disclose things until maybe until they feel safe. Sometimes it wasn't until after they were removed in foster care for years that they then would make disclosures as to what was really going on in the home. So I encourage everyone to, if they have concerns, to make a report, but support those social workers, and kudos to them to helping families. And now I'm going to turn the mic back to Denise.
Let's give a clap, everybody. That was great. Thank you so much.
Yes, thank you so much. And we do have another question from Jill Fellow. Barbara mentioned that Utah parents don't want to be told how to parent. Have free-range parenting laws hurt the system's ability to protect children? As a mother of 4, I'm a huge fan of free-range parenting protections, but I am interested to hear if that puts Utah kids at risk. Barbara?
I didn't feel that it put children at risk. I think it added more common sense to the investigation. It was kind of, yes, a 12-year-old can, or an 11-year-old can babysit their younger siblings, and we don't have to have those concerns. I think it just actually added a little more common sense of how they were looking at the family situation.
Thanks. Anything else?
Yeah, let's see. Daisy Thomas asks, what can be done about the inevitable skyrocket of child pornography in Utah?
I'll take that unless Barbara.
No, go ahead.
Go ahead.
It is an absolute scourge, and I think that Internet Crimes Against Children Division is the office through the Attorney General's office that prosecutes those crimes, and I think that those are incredibly difficult cases, and there are so many of them that I don't know if you, in several months before any coronavirus concerns, there was the offices that prosecuted those cases had just, there was a huge story in the New York Times that talked about the incidents and how those offices really have to prioritize, which is just devastating for me to think about. They have to prioritize infants, because even toddlers or older kids, there are just so many cases of open child abuse and child sexual abuse online that the caseload is just too vast for their ability to go after and prosecute in these cases, and it's really devastating. They do the very best they can, but they have to prioritize, and they prioritize infants. So,
and they need funding. They need funding.
They need funding. Yes.
That's the political leverage there. They need funding, and we should all be advocating for that funding.
Yes.
Absolutely. Thank you so much. That was just terrific. Yeah, give these people a clap. Get that on that little reaction button. Give them a clap. Give them a thumb up. Nice work. It was really, really great. So I just want to remind you that we started the donate your gift card campaign for the YWCA. So if you do have those gift cards hanging around, hang on to them, put them in an envelope, and I'll be blasting out the post office box address for you all. I also want to say that we've got candidates here, and we'd like for our candidates to take just 1 minute. Sorry it can't be longer. We're going to try to set up some venues where we will have longer conversations with some of our candidates, but we've only got 1 minute. So let's see. Lynette, do you want to start? This is Lynette.
Hi, I'm here.
Okay.
Oh, sorry, my video went off though. There you go. Thanks, Robin. I am going to just thank everybody so much for the wonderful presentations today. It was great to see Congressman McAdams here as well. And in my 1 minute, I want to particularly thank the Women's Democratic Club for all of their support. A lot of the conversation today has been about fundraising for so many important issues. And the best way to support these issues is to get us candidates elected who will fight so hard to make sure policies, programs, funding is in place to protect this population of kids and women who are experiencing these really challenging times right now. But again, thank you for coming to lunch today. Your donation means so much. I've already received my first donation on behalf of the Women's Democratic Club. Can't thank you enough, and I'll look forward to talking to you again when we have more time.
Perfect.
Thank you. Hey, can I just make a suggestion, a reminder to all candidates? name your website, ask for donations, and then once you're done, put your website and phone number in the chat window.
Perfect.
Can I
Thank
say
you.
something?
Okay.
I'd like to say something if possible. And my the company I just founded supports Democratic women candidates. www.programs4.com for candidates.com. There, I tried to say it too quickly and I goofed up, but contact me and I'll be happy to share the information. It's kind of a different approach.
Okay, perfect. Who else do we have that's running? Put your hand up in the air. Olivia, are you still with us? Diane, let's go to Diane Lewis. You have to, there you go.
Okay. So I just put Diane Lewis, HD43, and then pushed the button and forgot to put all the other information. So I'll follow up with that. So I just also want to tell everyone, I was married and had an abusive relationship. So this hit home for me a lot. And the help that I got from agencies, I lived in California at the time, but the help that I got from agencies was absolutely amazing. We were able, my son and I were able to do counseling together through the state, and it just changed my life around to be able to get out of it. And I had to be pulled out of the relationship. I was that bad. But my life now is amazing. And I want to tell all those speakers, thank you for all of the support that you give women and children. And it's heartbreaking. It brings me to tears when I hear you speak about it and how emotional and how connected you can be. Personally, I'm not sure that I could handle it. I think I would be crying 24/7 and, would be a wreck because I'd want to scoop in and hug those kids. But thank you. Representative Congressman McAdams, absolutely an amazing man. We've got to get him in again. We definitely don't want Kim Coleman there. I don't know about you guys, but I think she's crazy. Anyway, so please, I'm going to put my website on there. I absolutely would love a donation. And I already have received one from the Women's Democratic Club, and I so appreciate all of you. And to be able to do this and see you all this way, I miss you all. I miss getting hugs, but we'll come together, okay? Love you guys.
Thank you, Diane. Thank you so much. That was terrific. And I just have to say, for those of you that don't know, Diane is running against Cheryl Acton. Now, if you really, give this woman a clap. And I don't care what district you live in, we all need to go to Diane's district and get Cheryl Acton out of the house. So absolutely, we are going to be so down on that. We're going to help everybody out, and this is her third time to run. Third time. We really have got to get out and support our candidates. Who's next? Kale, are you there? Oh, Chris Peterson.
Hello, everyone. My name is Chris Peterson, and I'm the party's nominee in the race for governor. It's an honor to be here with you today. Many of you I've met already, others I have not. Just a little bit about myself. I'm a fifth generation Utahn, born and raised out on the west side of Salt Lake City, raised by a single mom, a disabled single mom. Came from very modest means. Today, I'm a law professor at the University of Utah. I also worked in the Obama administration at the Consumer Financial Protection Bureau, focusing on trying to make sure our financial services are safe and transparent and work for ordinary Americans. And that's what my focus has been on throughout most of my career. I'm very interested and excited to learn about all the wonderful projects that are going on. The Domestic Violence Coalition really sounds amazing. And I would hope to be an advocate and an ally on all of those issues if I'm lucky enough to be elected. I'm excited to try to help out the Democratic Party, build our brand, and help some of the down ballot races, and do everything I can to win in this race. And I also am hoping to hand it off to my lieutenant governor candidate, who is also with us today, Karina Brown from Cache County. Maybe pass it on if it's okay to pass it on to her next. Would that be all right?
Good with me. Karina, take it.
Thank you, everyone.
Thank you so much. I'm honored to be on this gubernatorial ticket with Chris Peterson, and I appreciate all of your remarks today and the guest speakers. I'm actually president of the Cache County Friends of the Children's Justice Center Board, so all of these issues are near and dear to my heart. I've seen the power of people working together in communities, not only in the state of Utah when we're together for Propositions 2, 3, and 4 and tax referendum, but here in Cache County, working together on different community projects. We're in the process of building a family justice center. We have the plans for that to increase victim services for children as well as adults. So I believe in our democracy. I believe that we can accomplish great things and solve problems together. So thank you for being part of the solution, and I'm looking forward to this race. So thank you so much.
Well, thank you very much. Thank you. That was wonderful. Okay, is Claire Collard in the house?
I'm here.
Go. Oh, good. Hi, Claire.
Hi.
Go, Claire.
Okay. Good afternoon, everyone. Thank you so much for being here and hanging in with us. What an inspirational meeting. This was amazing. And I am running for House District 22. I am running to replace Representative Sue Duckworth, who is retiring. Those of you who know me, I've been involved in politics for the last 10, 15 years. I was your Salt Lake County Party chair, and I've ran for Senate twice. And so I have run in this district before, but I can have a target on my head, on my forehead, because it is an open seat. And so I need help. The gentleman that I'm running against is backed by, Americans for Prosperity. So I'm going to need your help. It was great to hear Representative McAdams speak. I work in the credit union industry and have been heavily involved in the last few weeks on the PPP loans. And so I've been in the front lines with that and helping small businesses. And I've spoken to so many business owners who are in tears with relief when they get those funds. So that's huge. I've also worked for many years on allocating funds for after-school programs, which I think ties into the whole domestic violence and child abuse aspect, because it's just another layer of security and aid for our working families. So my website is electclairecollard.com. And I will put that information in the chat. And I appreciate the Women's Democratic Club. You've been with me from the beginning, and thank you so much for your support.
Claire, we are going to get you elected this year. I just want to say, we are going to give that woman she has run, give this woman a hand. I mean, really.
Thank you guys. I appreciate it. All of you.
Have we got Gaylyn Binion with us here? Gaylyn? She was here. How about Kale Weston? Gwen, do you know if Kale had to hop off? Well, we're thrilled that he was here. Olivia.
Hi, everybody. Hi. Am I on? Am I go now?
Go, Olivia, go.
Thank you so very much. Well, hello, everybody, and this has been such an informative session, and I'm really, really happy to be here. So my name is Olivia Jaramillo, and I'm running for House District 14 in Northern Davis County, and my opponent is Carrie Ann Lisenby, which is somebody who doesn't stand up for a lot of women's rights, and does it very, very, very very openly. And she doesn't stand with other women in the legislature, which it's disheartening, but we're going to correct that. And one of the things that I have actually done is we've already started phone canvassing. In the phone calls that I have made, I have actually taken phone calls from some people that work for child justice centers up here in Davis County, as well as some in Weber County, and they have raised so many of these same concerns that we discussed today. So it is very, very important that we get behind these issues and we support them. It's so important that when we do that, we support the middle class. And that is the backbone of our country. It's the backbone of our state. And it is so important that we support that we support families, that we support laborers and workers' rights. It is so important that we do this. So I really ask for all of your support. We've been so fortunate to put together a team to have people make calls for us, but we definitely can use everybody when it comes to beating Carrie Ann Lisenby. And not only that, in actually making a difference in Davis County. My point was to retire from the Air Force. I retired from the Air Force last year. And my plan was to move somewhere else to start something politically, and of course, Salt Lake County was the obvious destination, but there is change to be made here in Davis County, and we cannot forget about the rest of our state. So I ask everybody, if you happen to be in my area, I ask for your support and reach out to me. I am very much available. oliviaforutah.com. That's my website. You can find me on Facebook, on Instagram, on any social media platform. And the Women's Democratic Club has been so gracious to give me this opportunity. And I ask for their endorsement as well. Thank you so much for your time.
Thank you, Olivia. Terry. No, you're on mute. There you go.
Does that help?
Yeah, it helps.
All right. I am running for Salt Lake County Council seat 6, and I'm in a heated primary, not where we expected to be, but it's where we are. I am a lifelong Utahn, raised in Cottonwood Heights, live in Sandy City. I've been a member of our Democratic Club. I have worked for Ben McAdams through many races, in fact, and all politicians for that fact. I am a 30-year retired employee of the Office of Recovery Services. So I do understand these issues of abuse. Many times when recovery services would get involved in the family situation, abuse would take place. And we had to work very closely with the both parents in order to make sure that that didn't happen. So it is something that I'm familiar with. And I have had experience with the Journey of Hope, as well as Voices for Utah Children, which also looks at some of those issues. So it is forefront for me, these type of issues that really impact our most vulnerable at their most vulnerable time as well. But like I said, I'm in a contentious primary. The ballots go out the 1st of June, and we have until the end of June to return your ballot. If you're registered as a Democrat, you will get the Democratic ballot. I would love to have your vote. I'm in Sandy, Draper, some Cottonwood Heights, and Midvale area. So look for me on the ballot. It's Terry Taparekasi. And you can find me at Terry TFORSLC, and I'll also put that on the chat here. So, yeah, we're out canvassing. We call it COVID canvassing. We're knocking doors, stepping back, and people are very excited to even talk at a distance. They've been locked up for too long, so it's been a lot of fun.
Might be a unique opportunity to get out now and be the welcome wagon back.
Yeah, we've had great reception. So yeah, COVID canvassing.
All right, I see we have Greg Skordas with us. Greg.
Yes, hi.
Hi, welcome. Welcome to the Women's Democratic Club, Greg. I think this is a first-time attendee, and we are delighted to have you.
Well, thank you. I'm very, very happy to be here. I'm not even going to talk about myself too much. I want to give a shout out to Jen and Lorianne, whose agencies I've had some tangential and sort of direct involvement with over the years. They've really been very, very good for women, for victims, and for children. I've known Barbara for most of her career as well. And I appreciate the opportunity to be here today. I don't have a primary. I've been spared. We were given some some numbers right before the convention from this Utah policy that we were in the 70%, and I guess we did a little overkill because I ended up with 97% of the delegates. So we avoided that. My opponents are in a dogfight over there on the Republican side, and there'll be a primary there at the end of June. So I don't know who my opponent is yet. I'm assuming it will be Sean Reyes. I think he's vulnerable. I think this is going to be a great year for Democrats, and I would close by just echoing something that Ben McAdams said right at the beginning. And today's been a very good example of the fact that we have a tremendous slate, a tremendous just whole pool of Democratic candidates this year. So we just need to get the vote out. Thanks so much for all of you for letting me be here today.
Thank you, Greg. We have Wendy Davis.
Hi, good afternoon, everyone. Glad to be here with you. I am running for House District 45, super excited about that. And I wanted to share with you a story, something that happened to me last week. I have been volunteering for the Salt Lake COVID-19 mutual aid group. And about once a week when I do grocery shopping, I ask them to please give me somebody in the community who needs groceries purchased for them. And last week I was paired with a woman who is a victim of domestic violence. And I do it very discreetly. I don't meet them at the door. It's very private, but just being able to serve her and ask specifically, what does she need? What does she want? What brands does she want? What does she need for her children? And we were working together for hours to get the things that she needed. And it was a pure delight to serve her, but it was also heartbreaking at the same time. So thank you for the awareness that you've created today. I'm concerned that the pandemic, as Ben mentioned, has amplified the disparities in our communities, the divides between haves and have-nots, people who can homeschool their children because they have the privilege to do that, and parents whose children are home alone because that's the only option that they have. So a lot of work to do. I'm grateful to be on the ballot with Chris and Karina and Greg and Ben and Devin and Kathleen and all of the folks, and looking forward to bringing this home in November collectively.
Yay, team. Okay, I'm going to go back to Cale Weston, I think, is back with us.
Yeah. Hi, can you hear me, Robin?
I can hear you.
Great. I apologize for the audio before. I also want to just say thank you for all the other candidates. It's much better when you've got company, and I believe part of our goal in our campaign is to show that a package deal with a D is in everyone's interest. So I look forward to working with Liz Waite, Deborah Gatrell, and others throughout our 14 counties to get a lot of good people elected. Chris Stewart is vulnerable, he's unpopular, and we can beat him. I support the reauthorization of the Violence Against Women Act, but I think if you look deeper at his record, there's a pattern of where he's clearly not doing the right thing on our issues. And I consider your issues to be my issues, and like I said before, that makes it our issues. So thank you for the support we've already got. Our website is westonforcongress.com. Hopefully we'll be out on the road from Big Water over to St. George, all the way up here to Salt Lake City. It's about half the state geographically, so we do need support to get our message out. But thank you for our speakers and everything that you're doing to help the most vulnerable among us. So I look forward to seeing you again in person before too long.
Thank you, Cale. Okay, we've got a few more candidates. Let's get them all in here and give them all just a minute there. Catherine.
Hi there.
Hi, Catherine.
Hope you can see me okay. Are we good?
Yeah.
Yeah. Okay, so I'm running out in HD 52. It's I was uncontested in the primary, but I do have a candidate, Candace Perucci, who was appointed by the Republicans after John Notwell left. So I am in a quite conservative district. But I just want to say, very impressed with the presentations today. I'm sure as everyone else is. I did do some work with PCA earlier in the last couple years as part of Healthy Harriman. I think it's what every community is vulnerable, and we just need to highlight both domestic violence and just protect our children as well. Yeah. So great to just be here and let you know that I'm going to run a race and I'm going to win. And we're going to make things happen down here in Harriman. So thank you so much for the presentations today.
Go team. I think we've got Mary Kay Da Silva on.
Yes, hello.
I'm Mary De Silva, and I'm running for House. Can you hear me?
Can't hear. Yeah.
I think I'm not on mute. Hello?
Gwen, can you mute yourself? Gwen? Hey, Mitch or Jill, can you mute Gwen? Thank you.
Mary, try it again.
Okay, can you hear me now?
A little.
A little bit.
Go ahead. We can hear you.
Okay, great. I'm Mary De Silva. I'm running in House District 4 up in Logan. And I also want to say thank you very much to the Women's Democratic Club. I really appreciate your support. And this was a very important meeting today. I really appreciate all the information from the ladies that spoke. My mother was one of the pioneers of getting the Battered Women's Center set up here in Logan, Jenny Box. When I was a child, I remember that she was researching it because we didn't have a Battered Women's Center. She offered up our house as the safe house. And I remember them bringing, I was actually a teenager, they would bring people that I knew to our house, you know, very discreetly in the middle of the night, and they would stay in our house. She was able to get funding to start CAPSA. So, and then when I grew up, I'm a public health nurse. I certainly witnessed a lot of child abuse in my career. My husband was an elementary school teacher, and I volunteered at his school. And I'm so worried about these children that are at home now with no eyes on them, as the speaker said. So I would very much like to get into the legislature to help fund a lot of these programs. Like they said, they need more funding. So anyway, that's, my website is desilvaforutah.org, and thank you so much for letting me attend today.
Oh, it's just so happy to have you. Okay, now we have, Catwoman is the name here I'm looking at.
Yes, I think what you're witnessing is my children hijacking my Zoom meeting and me not realizing that. I am not a Catwoman. I am France Brawl. Apologize for this, but I think you'll understand. All of you will understand. Thank you so very much for the presenters of today. I think it's just heartbreaking to hear these stories. I am running for Grand School District, Precinct 1, and I have priorities in my campaign. By my top priority will be then to try to bring all the students back following COVID-19 and make sure that there's no achievement gap that I think we'll be witnessing. And I will like to reach out to Lorianne Thorpe as well to see how we can help because I think this is just completely unacceptable and we must do things. I've been involved in schools with my children. I've been a huge proponent of public education, and that is why I'm running for Grand School District Precinct 1. My website is francebaral.com, and I'll just put it in, and I have an Instagram account, a Facebook account, and I would love to hear from you. You could reach out to me. I'll reach out to some of you as well, and I appreciate all the support you can give me. Thank you.
Thank you. And this might be the last word is coming from Kathleen Reeby, Senator Reeby. Did you have your hand up?
I did. Thank you so much. Thank you to our presenters, Jen, Lorianne, and Judy. This is a great year for Democrats, and we need to make sure that all the down ballot races get attention. They make the biggest impact in our local communities. Our families, our communities, and our neighborhoods, schools are essential. So domestic abuse is not only an egregious violation of our children and our families, but it also is an expensive situation for our communities and our state. I've worked to pass legislation for healthy lifestyles because some of these kids, they don't know they're being abused because this is their normal. And we're working to get nurses, social workers, and school psychologists into every classroom and into every school at a higher capacity so that the rate of helper to student is higher. So thank you for all you have done for moving these issues forward. Thank you.
Thank you, Kathleen. Well, that was fun. I'm going to just remind you that our next meeting is going to be on June the 6th. We want you to come. We want you to donate. We want to do this again. And I will tell you that the first wave of money has gone out from the Women's Democratic Club to candidates who did not have a Democratic component, and they were non-incumbent. In other words, this was their very first time to run, to give those candidates a little boost right at the beginning. But we will be sending out our second and our third wave, and hopefully fourth and fifth wave of donations that will go into candidates. So please continue to come, donate your lunch money, join us, and be safe, be well, and look for those gift cards that you can donate. I'm going to be expecting some mail, okay? Thank you all so much. Have a lovely afternoon. Bye-bye.